Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center, Ask the Doctor Anything series. We do this every Tuesday at 6 o'clock in the evening to 7. And we, as functional medicine integrative doctors who are trained in standard allopathic medicine, the six of us here right now are all trying to work with helping you to develop healthy lifestyles, address the many questions you have about the challenges of the industrialized world, the stress that we have on exposure to GMOs, toxins, chemtrails, heavy metals, uh, and the stress of the electromagnetic energy, and to give you some information about how to start improving your lifestyle to improve your health at any age. So what we do is every week we have at our site here a tlcdoctors.com website where you can get onto our newsletter, tlcdoctors.com. And there you can get on our newsletter, and there'll be a link there if you have a question for us here to do on Tuesdays, so that I get your email questions and then we try and cover them all. And the other thing is on YouTube. If you're on YouTube, you can type into the chat, and I try and answer the questions that are live on the chat as well. Now, I don't know everything. I will answer the questions to the best of my ability. As a general practitioner of 43 years, I'll be happy to try and speculate or give you my opinion, or if I do know the answer, I'll try and give you the answer to general questions, but it's not meant to be personal medical advice. This is designed to be general approaches for functional medicine for your health. If you have any serious questions or symptoms, please do call your doctor. Or if you're one of our patients, make an appointment or call us. Of course, if it's anything serious, then you have to use urgent care or your ER. So let's begin today with our questions. We have email questions, and we'll start with Lena. And Lena asks the question, should you exercise in the morning before eating, or should you have some protein before exercising? Well, this is an argument that goes on forever. If you go into ancient medical history, I think you look and learn that the Roman soldiers were only fed once a day. And the argument there was for improved performance when they were doing their job, training or fighting, when they only had one meal per day. So there are those who would argue the blood supply will go to your stomach for circulating your intestines and running your digestive systems. And that's maybe up to a third of your blood supply. So I would not exercise myself. I fall into that camp suggesting that you should not exercise before or you eat. Wait a minute, I said that wrong. You should not eat before you exercise. You should not eat before you exercise. You can certainly take a rich high protein. A lot of people use creatine supplements, amino acid supplements after a workout, because then your muscles have tiny micro tears that need to be repaired. But I'm going to fall in the camp where you should not eat before you exercise. I would rather see you take the protein afterwards. All right. Then Jennifer asked the next question, what could be causing my left leg, ankle, and foot to be puffed up or swollen, quiver and shake with pain in my toes when I walk? I had my ankle and foot x-rayed by a foot ankle doctor. So you are seeing a doctor over this, Jennifer. That's good. With no findings, so they couldn't find out what was doing it. And then apparently you were sent to physical therapy because you said, my physical therapist thinks that it could be coming from my spine or pinched nerves. So a MRI is scheduled for my spine. So it looks like you're getting a good workup, Jennifer. Thank you. So what could be causing? Well, Jennifer, I don't know if you had a fall. I don't know what your age is. I don't know what your weight is. I don't know what other comorbidities or illnesses you may or may not have. I don't know what your prior lifestyle has been. I don't know what the state of your prior history of exercise is, or what your posture looks like, or if you have childhood scoliosis. I mean, all these things play into a unilateral limb nerve pain with what you're calling quiver or shaking. So it certainly sounds neurological. So all those things have to be addressed. This is why we're very aggressive with our patients in talking about good hydration. And now we're learning more about the energy of water in structured water, and that it is actually a energy transducer for the cell membranes that are all over your cells and inside your cells and around your nucleus. So structured water is very important for cell function and energy. We tell our patients you are batteries and you need to get yourself charged up. We tell our patients to ground themselves, to go outside in the morning with their feet in the bare grass, and to be there in the morning with the rising of the sun. There's long far red infrared waves that can penetrate right through bone in your skull. And this can get to that structured water that's surrounding all your membranes and intracellular membranes to enhance the potential dynamic of the voltage, and that is translated into energy. And if you have a habit of doing this, I try and go out every morning around somewhere between 6:30 and 8 o'clock in the morning. Usually I get out there about 7:15. I'm out there, I would say, a couple, 3 minutes, no less than a minute and a half, really not much more over 3 minutes is what I'm finding when I look at research or listen to lectures on it, to charge up yourself, to give you energy, to maintain posture so that you don't pinch nerves. Because as we age, we start to slump and we start to get kyphosis. Our head starts to go forward. We get the dowager's hub. Osteoporosis promotes this. So as the body of the vertebra compresses, and with lack of hydration, and the intraspinal muscles and ligament get more stiff and dried, and the muscles weaken, then your whole posture, your musculoskeletal system is going to determine your posture. So we talk about exercise, 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 weight training, weight training, weight training, hydration, hydration, hydration. And now we're trying to emphasize good circadian rhythm and light hygiene, meaning turning off these blue light modalities, the screen that you're looking at, and let things get dark, shut off your electronics, get to bed, get up before or with the sunrise, get out there right away, get your feet wet, get grounded, take your glasses off, let that infrared pass through to you, get in some weight training, and then eat plenty of protein. I'm telling my patients now, to age is to become a weightlifter. To age is to become like or become a carnivore. To age is to focus on hydration. Um, and to age is to work on your uh, light cycle hygiene. And so we we find these things to be very beneficial. So Jennifer, we have to know, if you're all these various things are impacting you. But it sounds like you're in the hands of doctors who are doing the appropriate workup. And I would just encourage you to do these things for exercise and weightlifting and muscle tone and stretching and posture checks and so forth. Nick says, "Hi, doctor. My friend just found out she has two cysts on her ovaries, one larger than the other, and is scheduling a surgery for removal." Now, usually they wouldn't just necessarily schedule a surgery for removal unless one of those cysts is looking big enough to put it at risk for being cancer at risk, or having some intra cyst kind of picture inside it that is suggestive that it is not a good looking cyst, that it may have some early signs that it could turn cancerous, because they don't just remove cysts unless they have features that make the doctor think there's some extra risk by size and by what's inside looking in the cysts. And so going on, he then says they're scheduling surgery. Okay. Do you have any counsel she might benefit from? You once enlightened me with the idea of starving cancers, if I'm not mistaken, by fasting and abstaining from sugars. That's true, because carbohydrates, sugars, fruit sugars, starches stimulate the release of the hormone insulin. Insulin is a growth promoting hormone, and it's probably one of our number one risk factors for neoplasia, cancers, tumors. But it also thickens the blood vessels, and it also promotes fat cell development. Could that work here? Thank you. Now, I am going to say this is something that she has to follow with her doctor. I have no idea what the cysts look like or anything, but as a general theme, systemic enzymes are what we give to our patients here that have polycystic ovarian cysts or isolated. Usually, the majority are benign cysts, and these ovarian cysts, if you take enzymes, they become uninflamed. These systemic enzymes are taken on an empty stomach, morning and evening, and we take like 5 of them or 6 twice a day on an empty stomach. So first thing when you wake up, last thing before you go to bed. But if you're going to have surgery, we also tell people with systemic enzymes not to take the enzymes for about 4 days, 4 or 5 days before surgery, because they do create a little bit of thinning of the blood, very minor, but it helps to prevent blood clots. And when you're doing surgery, he has to cauterize little tiny arterials. And so you don't want to have enzymes 4 days or 5 days before surgery. So that's our protocol here, is we tell people not to do that about 4 or 5 days before surgery. But then we say the day after surgery, then we ask them to resume, especially from all the debris and trauma and inflammation from the assault of the surgery. So another thing we do is we usually recommend natural progesterone. Progesterone usually has a staying effect on any estrogen growth promotion of the lining of the uterus, because when you ovulate and you produce progesterone, as that progesterone is raising and building up, it puts a stay on the estrogen development of the thickening of the uterine lining. And then when the progesterone drops off, as far as it's not being produced anymore, so it's about 2 weeks out of every monthly cycle for a woman, that drop off phase is then usually associated with the onset of her menstrual cycle. So that lining of the uterus is sloughed off. So progesterone also is associated with helping to prevent the ovarian cysts. So we tend to give that as well. We like to get a blood level somewhere around 6 to 10 or higher in the serum test for progesterone levels. That and a very, very low carb diet or a carnivore diet. Exercise to improve circulation, healthy amounts of vitamin D and a multi-mineral for your selenium, which is an anti-cancer, and zinc, which is an immune supportive, plus the wonderful aspects of potassium and magnesium that are in these TLC multiminerals we give. And not eating late. We promote fasting, intermittent fasting. So we, depending on knowing the patient and their health, I don't know who your friend is, but if a person's able and they're not, let's say, an insulin dependent diabetic, usually people can do a 48-hour fast very well. And that helps lower insulin to stimulate the growth of tumors or cysts, various things like that. And then we talk about doing a 2-day fast on a cycling basis. Intermittent fasting is another item you could do, where you would just eat, let's say, breakfast and lunch, and then not eat until you get to the next morning breakfast. All these things would be the direction we would go with. Let's see, Jocelyn asked the question, Father 72 is suffering from bad neuropathy, pain in the feet. Seems to feel worse at night and is interrupting his sleep. Overall, he's very active and healthy. Any supplement or recommendations for treatment relief? Well, Jocelyn, again, I don't know your father. I don't know what other comorbidities he may have, or his weight, or his posture. Diabetes, pre-diabetes, chronically modestly elevated blood sugars, all are associated with damaging the vasculature lining the inside of the blood vessel, the nerves, and these things are improved with EDTA chelation therapy. I just had a lady this week, I think she was 68 years old, who had been doing chelation as I recommended, no less than once a week. And she did that for a series of about 3-4 months. And she found her neuropathy, the burning feet that was worse at night, to be tremendously improved. So whenever you improve the microcirculation to all parts of the body, and remember the feet are part of the most distal in your hands as well. When you get better blood supply there, more nutrition, repair, waste removal, you start having less symptoms of pain. The other thing is enzymes will help reduce the inflammation of cell damage, which will reduce the pain. We were talking about this structured water where we use this analemma wand, where we get the this water inside this wand is at analemma-water.com. And I put this into my water here like this. So it's training all the water that I drink to have structure, meaning that it will help provide more of an electrochemical potential across the gradient of my membranes, so they'll function better. That also would help with pain and neuropathies. It would help all the cells in the body, and that's rather instantaneous. So this is called ANALEMMA dash water.com, analemma-water.com, analemma-water.com. You can learn about that. It's about $170, but that's the total cost of it, and it'll do you well. That's what I would recommend for people with neuropathy, with EDTA chelation, a low carb diet, enzymes, adequate hydration, exercise. Kathy says, hi, Dr. E. I have a good friend, female, 69-year-olds, no chronic health concerns that she's aware of, who has been having frequent panic attacks. Would you speak to possible physical causes of panic attacks in general? Physical causes of panic attacks. Well, minerals are very much, and her blood type would matter. I would get her blood type. I tend to see more panic attacks in blood type A's. If A's don't have, as a class of blood type people, enough digestive enzymes from childhood on, then they're not digesting their food as well, which means proteins and fats, and we're made of proteins and fats. They would have that wonderful cell membrane that's supposed to insulate the nerves and all the cell membranes in the body. Their structures would not maybe be as good as a B, or an O. Therefore, neurological irritation could occur if you had the myelin sheath or the cell membranes. Remember, we have this picture that we're always showing where you have the damage to the cell membrane, and these fats are in your diet by eating meat, fish, egg yolks. Let's see, I went out for lunch today, and I was at where did I go to? Mimi's Cafe. I was trying to get a lemon meringue pie for my husband because it's his birthday today, and lemon meringue pie is his best. And I just didn't have time to bake it, nor have I made really lemon meringue pies. I'm not too good at it. Anyway, I got there, and there was a misunderstanding. They don't have pies; they have muffins and stuff. So anyway, I was hungry before too much. The lunch hour had passed, and it was like around 3 o'clock. So I asked her for a steak and 2 eggs over easy. And she said, "Well, what do you want for salad?" I said, "All I want is a steak and 2 eggs over easy." And she said, "Well, what do you want? Bread or potatoes, or do you want rice?" And I said, "Oh, please, all I want is steak and 2 eggs over easy." And then she said, "Do you want any vegetables?" And then I said, "All I want is steak and 2 eggs over easy." It's so funny sometimes trying to order things at restaurants as a carnivore. They just can't imagine it satisfying you. But I had a 10-ounce steak with the 2 eggs, and it was scrumptious delicious. And that egg yolk and the fats and the minerals rich in all that is going to be so nutritious and helpful in repairing these uh, injuries right here, because those are phospholipid fats and proteins that every cell in your body is made of. And now that we're in our 70s, I have to be very, very careful to try and repair it. So when you're saying panic attacks, A's as a class of people have more of those injured cell membranes, injured lining of the sheaths of the nerves that are made of all those phospholipids. And they can be easily tipped off and triggered by any stressor. So I would encourage them to take the digestive enzymes for blood type A. I would encourage them to really work hard to try and eat more egg yolks, eggs, more meat, more salmon, more chicken with the skin on it, and more pork, more bacon, and really reduce their carbs, and to exercise, and to the same thing with this water. This structured water would be very important, not only to drink enough water, but now as we're learning to maintain that electromagnetic difference in the energy between the membrane surface as you go out from the membrane, the negative to the positive, to help the energy potential of all the cells be better across the membranes. That is what I would recommend. Debbie says, "Hello from Arkansas." Wow. Hi, Debbie. "I'm currently receiving weekly chelations via an IV." Okay, good. "I have moderate to severe stenosis of the cerebral arteries." Now, are you talking about the carotid arteries? Because usually there are the cerebral arteries, circle of Willis and stuff in your brain, if I remember back from anatomy in the 1970s. But usually, if we're talking carotid, the carotid arteries don't become hemodynamically worrisome or significant until it exceeds 75% to 80% blockage in the carotid arteries. And that's when you start to hear that whooshing with each heartbeat of that whoosh, 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 with a heartbeat as blood flows through a narrower space. So if you have moderate to severe stenosis, you're probably not at that level yet. But yes, EDTA chelation with a very low carb diet, with exercise, with enzymes, with taking vitamin D with K2 at substantial levels. I would probably say K2 180 milligrams a day minimum, vitamin D probably 10,000 international units, never eating late. And you said you are on the 28th of 40 planned weekly IVs. Then you're going to do once or twice a month for maintenance after that. Any words of wisdom, encouragement, or insight? Um, I think you're doing a great thing. We all need it. It's just the powers that be that set up the control mechanism in this centralized medical beast control system. They won't let people know we're all exposed to free radical oxidizing heavy metals that they dust on us in these chemtrails. And it's in our food, it's in our water, it's in our air. And there are no safe levels of heavy metal toxins. And EDTA is an anion that is attracted to the cation. All toxic heavy metals, aluminum, lead, arsenic, cadmium, they're all positive. So it grabs onto it and helps you urinate it out. We even are able to chelate people with kidney disease. Dr. Lynn has published with chronic kidney disease patients who have very poor kidney function. He slowly chelates them until they improve the microcirculation in the kidneys. So I am so proud of you for doing chelation. Do the systemic enzymes, do a low carb diet, do not eat late, drink water, try and look into structured water, look up the analemma-water.com, learn about those things, and that should help you. Take your D with K2 as well. Constance says, what is your opinion on cryotherapy? There's nitrogen, oxygen, and cold water plunges. They're becoming popular. Well, interestingly enough, this cold water therapy is associated with this cell membrane water structure function around your cells. So we all are emitting infrared heat all the time. So if you have night vision goggles, you can actually see the human beings in a dark room, and the furniture, everything is emitting some form of heat, so that you can navigate walking in the dark with night vision goggles on, because everything is emitting heat, humans especially. And all those cell membranes have this structured water around the membrane. And when you do a cold plunge, there's a stressor put on you thermodynamically and electrochemically to respond to the thermal challenge. And that electrochemical response throughout all your body is impacting in a ripple effect the multidimensional magnificence of cell physiology and electrochemistry and photons. When you do that, when you give it a little bit of a charge, we're seeing side benefits of the improved immune system, the improved metabolism, psychological, immune, and mental calming aspects of this, because this water does impact the cell membranes in the brain instantaneously, and it's very calming. So yeah, I'm all in favor of cold plunges. That may be the one thing I don't do in my life for anti-aging. I probably won't be someone who's a cold plunging person. The closest thing I get to being cold is I never get cold. So I won't let myself get cold. So I don't see myself doing that. I might have to go to heaven without the cold plunge. Anyway, yeah, so I'm in favor of it. Debbie says, I submitted the question that mentioned I'm receiving chelation. Oh, you're the Debbie from above, okay. Uh, for cerebrovascular disease. I'm also a naturopathic doctor and use many of the modalities you mentioned in a Q&A from 2021. Any of those that you believe would be particularly helpful? Again, thank you. I just read your books, Detox Outside the Box. I'm excited to try the suppositories. Well, I don't know that the suppositories will be made like the ones we used in our research, because we used a certain kind of suppository that enhances the capability of repairing the cell membrane here. And they're not doing that with suppositories now. It's usually a cocoa butter or a glycerin base for a suppository. And then they put calcium disodium EDTA into it. Never use the magnesium because that will create a burning sensation in your rectum. That's been tried before, and it's not a pleasant feeling. So use the calcium disodium EDTA 1500 milligram, and it would take 3 of those, at least in our studies, with our high quality suppository matrix, which you don't have now if you're just using coconut or glycerin. So it might take 4 suppositories, 5 maybe, to equal the equivalence of 1 standard chelation IV. But that's, if you can't get the chelation IV, it's certainly valuable to use it. And then, of course, systemic enzymes are helpful. I think I brought that up already as well, with vitamin K2 with your D. So there you have it, Debbie. Well, God bless you. Leah says, hi, Dr. Ellithorpe. I just want to say thank you for Dr. Kaur. Well, what a beautiful thing. Dr. Kaur, Kaur, has been with me, maybe 15 or so years. She started here as a front office girl when she was at the Irvine University, and she changed her major to chemistry to mimic what I had done, because she was so happy with seeing patients getting better here. She changed her plan to become a doctor herself. And after she got her medical degree, then she came back to work here. And what a blessing she is to us and to her patients and her family. Thank you for saying the things about her. She's been such a blessing in helping me get my health on track, and her care and kindness for her patients is so appreciated. And also, your entire IV department people are amazing. Thank you for the TLC and all that make it so great. God bless. Well, thank you, Leah. Thank you for those kind statements. And I will make sure Dr. Kaur got this message. Mary, what are your thoughts on tirzepatide, which is Wegovy? These are semi-glute GLP-1 inhibitors for stubborn weight loss, especially with someone who has physical limitations preventing a lot of exercise. Mary, I have negative feelings about the GLP-1 agonists, and these are newer, and there are black box warnings on these for thyroid medullary carcinoma. It is something that has to be monitored. It is associated with a plethora of side effects, and they believe it's the neurogenic because we have GLP-1 receptors on many of our organs, not just in the intestine and up into our brainstem. And we believe that the nausea, the associated gastroparesis, the vomiting, constipation, diarrhea, pancreatitis, bloating, these things are, I just don't think something that we should tolerate. Oh, what Novartis, I think is the producer, and the study involved, I think, 1,900 people, and all the people on the study, all the doctors on it, were all paid from Novartis. And so when you get a study and all the people on it are paid by them, and you get these great results, then I am suspicious of them. So I have concerns about that. I do not think it's the right thing to do. I actually think of this kind of like heroin addiction and developing Narcan for it, and drug rehab centers, because people who are going to use Wegovy and these GLP-1 agonists and inhibitors, and there are other classes coming out. There's three classes: GLP-1 agonists. Uh, I don't know the identification of the other two, but all this stuff messing with the central feedback mechanism of satiation, uh, gastric secretions, insulin secretion, glucagon response. These are all being messed with drugs and chemicals. We are concerned that you'll wind up having to be on this lifelong. And the cost of it right now, I think, is something like 1,200 a month, and I am not in favor of this. I am for only using this in a last case, desperate for serious morbid obesity with other cofactors, ischemic heart disease, or other terrible risks that would put them at risk for dying. Therefore, I would risk maybe a medicine like this that's so new, and it's already got black box warnings for cancer. No, I cannot use my own patients as guinea pigs like that. Sorry. So that's how I feel, Mary. Um, Asia said, "Hi, Dr. Ellithorpe. Do you have a recommendation for an air purifier?" Oh, uh, Kenmore has come out with one that's probably the cheapest and the most researched is beneficial. Then there's another one. I think it's called Gateway. But you see, a good air purifier not only has a HEPA filter for the particles, the actual particles coming through, but then there has to be a carbon filter to try and get, things like uh, um, uh, toxins like um, fluorocarbons, benzene rings caught into the carbon. So it's got to have these two levels as a minimum. And then you can get even fancier with that. Then there, there are monitors, the noise quality, the fan strength, the cost of replacing the filters, and looking for good um, testing for particulate smell from these benzene carbon rings of fumes. All these tests are done, and I know the new Kenmore one for a room or office is good, and the other one I think is called Gateway, but it's more expensive. So that's what I'd say, Asia. Genesis 1 says, "Do you have a recommendation for a chiropractor in California?" Um, I I like Dr. DeMoss, who is in Newport Beach on Orchard Avenue. He's in Newport Beach on Orchard Avenue, right off of Irvine Boulevard. Dr. DE capital MOSS. Jennifer says, "What can cause blood in a stool?" Well, that needs to be worked up by your physician. The first thing we get concerned about is colon cancer. So you have to have this addressed by your doctor. But it could be a hemorrhoid. It could be misunderstood to be blood by, there are certain things people eat beets and their stool looks bloody and it's really not. Black tar, if your whole poop is just one solid piece, it looks like as black as this. That's what we call upper GI digested blood, not specks of black, but the entirety of the stool is a solid piece of black. We would be concerned about that. So you have to have that checked out by your doctor. We must rule out serious things first, like colon cancer or an ulcer or a hemorrhoid, which would be the least of our concern, but those can be problematic too. Marianne says, what is the best way to help with osteoporosis? Well, we like natural hormones because they help support osteoclast and osteoblast activity or bone building and remodeling in our bones. We like sudden deceleration exercises like weightlifting, stomping, rebounders. We like um, using vitamin D with K2, and then monitoring this and then checking serial bone densities and seeing how hormone levels with the D with K2, along with your exercise and good hydration, supports this. That's how we do it, Marianne. And then Mary says, hi, Dr. Ellithorpe. I love listening to your weekly episodes on how we can improve our health. Thank you. Well, thank you for saying that, Mary. I am 78 years old. I use estradiol vaginal cream 0.01% once a week. And recently I started hormone replacement therapy. What strength and type of estrogen would you recommend for a dry face? Thank you. Well, that you could use Tri-S, Bi-S, or estradiol. I have long since, over the decades, given up Tri-S and Bi-S because these are just tiny, minute variations. I've never seen the practicality and the cost value of combining E3, E2, and E1. So E1 is estriol. E2 is the thing I use, estradiol, and E3 is estrone. Wait a minute, estrone is E1, excuse me. Estrone is E1, estradiol is E2, and estriol is E3. It was the reverse. So I only use estradiol. And I usually use it as a 1 milligram per dose, is either as a topic click or as a syringe squeezed out. And that's what I put on my face, 1 milligram a day. And I'm in my 70s also. So, but you have to have that checked by your doctor because this will really absorb, especially when you rub it over your eyelids and all around. Your face is very absorbent, and we want to make sure the levels are not too high nor too low. So if you do something like that, please have a doctor who will check your levels after a month or two using that way and adjust accordingly. John says, if you have your last meal at 2 p.m., what tricks do you employ to resist snacking until 9 when you retire for the day? Do you use water, chew gum, what else? Or just old-fashioned willpower? Mostly it's old-fashioned willpower. I tend to, if I do anything, I take warm coffee black. I drink my coffee black because I do so much talking. I get a dry throat. And I'll put a tablespoon of butter in it. Another thing I will do is put some MCT oil in it, or I'll take a swig of olive oil. So those are my cheats. Frank says, a few years ago, one of your doctors recommended a daily CBD oral supplement from Prime My Body. Do you recommend them because of their scrupulous sourcing process? I've used this product ever since, and it's very beneficial. But now they're out of it. Is there another company that you can recommend as highly? And the answer is no. We don't know of another one, Frank. I'm sorry to tell you that. But I guess you'll have to try just like everyone else, and see if it has as good an impact as what the original had from Prime My Body. I don't know why they don't have it anymore. Mickey says, I'm 75 years old, 5'8", 134 pounds. I have allergies, so you don't eat dairy or bread. You've tried the low carb and you began to experience constipation. I added more vegetables and fruit and drink 60 ounces of water a day. Still, the constipation remains. My OBGYN referred me to the pelvic floor physical therapy because I do have a vaginal prolapse, and you are seeing a urogynecologist soon. The microbiome leaky gut issue, she's concerned may be an issue, has the question, how can she heal? Um, well, I don't necessarily think you have to have a bowel movement every day, especially if you're a pure carnivore. Um, I would try a good multi-mineral. We have the TLC multi-mins. That's what I use. And if I'm concerned about cramping or enough potassium, magnesium, selenium, calcium, manganese, all these wonderful natural hormones, they're albion chelated to amino acids. So I'll use from 3 to 6 a day. The other thing is I will take the orthomolecular's buffered vitamin C capsules, 750 milligrams, and I will take one every half hour until I start feeling like my bowels are churning or I have a hint that I need to have a bowel movement. And then I just back off. So oral vitamin C capsules ad lib until you feel like you have to move your bowels. 3 to 6 TLC multi-minerals will help as well. And the water, if you use structured water, they're doing a lot of microbiome studies currently showing that this is really enhancing the microbiome of the gut. So I felt it instantaneously when I started using this 2 months ago with my workouts. Now I am actually feeling that even my regularity as a carnivore is enhanced. So uh, I'm going to say structured water, the Analemma 1, drinking that 60 ounces might be something along with the vitamin C and the multiminerals to do. Dawn says, is infrared sauna risky for someone with brain aneurysms or any type of aneurysm? I don't think there's been any specific study that I know of that has looked at that question in particular. Instead, there are studies of sauna, especially the Finnish studies, associated with all-cause mortality reduction. We're talking large, significant reduction in all cause of mortality for those who are doing sauna and infrared saunas 3-4 times a week. So I've got to assume that this would have nothing to do with it, but I can't give you a specific answer. I can just tell you what my thinking process is. Art says, do you think handheld massage guns vibrating the neck area are helpful for lymph drainage, especially for the people who cannot use rebounder? Well, I'm all in favor of massage, whether it's a motorized hand, one that does that over you like that. And I've got to assume that it's going to necessarily help with the lymphatic flow, but we can't think like allopathic physicians, like my medical training. We have to think the water is important. And now we're learning the tremendous life of these structured water issues. That water is far, far more life-giving than we ever envisioned with the energy potential of the negative, positive variations of the oxygen to the hydrogen lining these areas. So there is a video called Dr. Gerald, Gerald Pollack, Pollack, the electrical water structure, something like that. I would listen to it. It is just fantastic. It'll excite you and help you to stay hydrated. So, Art, yes, I think the water's important. I think you need to not gummy up and make it sticky with a high carb diet. I think you have to use enzymes. I think you need to honor the circadian rhythm of the sun, day and night cycle, and get electromagnetic features out of your life and area. All these things matter, Art. Cynthia, what is an alternative to chemotherapy for a recurring cancer? Well, Cynthia, I am not an oncologist and we don't treat cancers here. What we do is to treat people who have cancer by telling them, one, they have to be managed by an oncologist or have them watch over them. And then we work on their immune system, their nutrition, their diet, and detoxing, microcirculation, things like that. Um, there are many supportive things that are exciting to read about. We don't treat cancer, so I'm not uh, uh, using these per se. One is the fenbendazole research by the Joe Tippin. Joe Tippin, I think, did he have prostate or lung cancer? I forget which one. But he used the dewormer fenbendazole, which is dog dewormer. It's a over-the-counter thing for dogs called Panacure C, the Joe Tippin protocol for his cancer. So we're learning things about anti-parasitic medicines. The same could be said for ivermectin. What else? These antiviral medicines are showing up as great immune support. Now, maybe there's a viral component to cancer or an immune damaging suppressive action to cancers from parasite involvement. And this is relieving the immune system so it can help to fend off from cancerous there's the avoiding the carbs, starving the cancer, looking at Thomas Seyfried's, Dr. Thomas Seyfried, Siefried, what I think he's at Harvard. He has the video called Cancer is a Mitochondrial Metabolic Disease. Cancer is a mitochondrial metabolic disease. And that's where he's saying the insulin is stimulating growth from our high carb processed diet. And that's why we're seeing it in younger and younger people. So these are all very interesting areas. But again, we cannot recommend an alternative to chemotherapy. What we can do is talk to you about your lifestyle, your immune system, your nutrient levels, deficiencies, your exercise, your hydration, all these various things. But you have to have an oncologist to manage you because I am not out there looking for breakthrough in any one line of cancers or new drug trials that are always being published at the NIH. That's what you need your oncologist for to manage your cancer. All right, now let's see what we have on the live feed here. We have Jen. Jen says, why do I get tinitus, ringing of the ears? Ringing of the ears, and how can you get rid of it? Well, that is an age-old question. This sense of a pitch ringing in the ear. There's brand new data coming out that it is actually aggravated by our electrochemical light pollution, the blue light, these screens late in the day, not getting up with the sunlight, the lack of water. There's even arguments that is saying the sound waves are transmitted into the endolymph of the cochlea that is transferred into light energy packages that is interpreted as a tone. So there's also it getting clogged up. You might say if you're chronically dehydrated, uh, if you're inflamed, lacking enzymes with aging, heavy metal toxicity, the aluminum is gradually building up, your bones are demineralizing, and in your bones exists a trove of heavy metal toxins that are now leaking out of your own bodies as your bones demineralize. I mean, there are many things. So we do chelation here. We are talking about water, and now the structured water with these analemma wands. And then we're talking about the anti-inflammatory diet of a carnivore diet and the enzymes to reduce inflammation and grounding your body by standing in the wet grass in the morning with the sunrise for 1.5 to 3 minutes, um, getting adequate minerals in your body. What else? Keeping it unsticky and syrupy by cutting those carbs down. That's going carnivore. So all these things would be a part of it, Jen. And if you put in Dr. What's his name? Jack Kraus, Kraus. He's a neurosurgeon, and he's the one who is very entertaining. For 20 years, he's gotten into photons, light, the electrochemical photon communication in brain. And he's the one who's talking about tinnitus, the endolymph of the cochlea in your ears right here, and the value of this analemma structured water, all those kind of things. So his name is Jack Kraus. Put in Jack Kraus, neurosurgeon, tinnitus, or something like that. But he's going to tell you the same thing about everything I just told you right now. Renee King says, can you recommend incontinence pants for mom? Bad skin now. Suspect is assurance pants. Oh, that must be name of a pair of pants that absorbs leakage of urine. Assurance pants. Color ranges white, red. Sores appear easily, itchy as heals. Bathe her regularly. Various salves do not help. Well, Renee, if your mom is bedridden, she's going to need, good care and light and aeration. And I would say Argentine silver is the broad spectrum antibacterial, antifungal, antiviral spray that you could spray on these bed sores, and they really do improve. If there's any way you can get her to get chelation, that will help. If there's any way you can get her to use some hormone replacement therapy, that will help with promoting healthier skin. And avoid these salves that are full of petroleum gel that inhibit cell migration. So you get the neosporin, polymyxin, which are the antibiotics in this petroleum gel. Well, the petroleum prevents the cell migration, but it's got the antibiotics. So you're stuck with the antibiotics, but no healing. So it's just foolishness. Use Argentine silver on these sores would be my recommendation for sores like that. I don't know of any particular anti-stress incontinence panties. I wish I could help you there, but I can't. Debbie says, this came up a few weeks ago, but I'm wondering what your health thoughts are on hybrid cars. I'm just wondering if we even know enough yet, or should we just avoid those cars for now? I'm telling you, the batteries and the electromagnetic energy, not to mention the amount of petrochemical fuels that go into the processing plants that make these silly batteries, lithium batteries, and the slave labor and the childhood abuse of kids who go into these mines picking out these rare earth minerals is being hid from you. The biggest abuser, of course, is China, who is producing all these coal power plants without any pollution control on them, and they're building new plants every month. So what's with that? All these tree hugging, earth climate catastrophe warning people. China gets exempt from this till 2050 or something like that. I don't think so. Anyway, I'm not going to be for electric batteries on cars at all. Lisa says, should I take a probiotic every day? If so, can you recommend a brand name? I use them because everything is diminished with aging, and we have so many chemicals and heavy metal toxins, high carb stimulation to feed bad bacteria. Why don't we make the effort to feed probiotics, good things into our bowels? But I'm really excited to see the new studies that are coming out. I haven't seen them yet on the water structure that's taken directly into the gut. The biofilm studies reportedly, I'm getting little signals from some of my colleagues saying, oh, it's really good. You can't believe it. Can't wait till it's published. Well, I agree. I want to see it published. So what do I use? I use Orthomolecular's probiotic, and I use their orthomolecular spore, Orthospore IG, because I believe in the spores as well as the probiotics, and I take one of each every day. That's what I do. And my time is up. And here's my last question. Do you know a good vascular doctor? I don't. I just don't. I'm sorry. And I wish I could say, I can't think of one off. The only one I did know, he just retired. So I've got to find a new one myself. So in the meantime, folks, thank you. If this is of value to you, please like and subscribe. Please share with your family and friends. And we'll see you next week at 6 o'clock in the evening, Tuesdays until 7. You can type in your questions, TLC Doctors, that's plural, tlcdoctors.com. And you can get on our mailing list and get notified of this, and the link to giving me questions, of course, the YouTube. And so take care of yourself. Certainly, you're worth taking care of. All right, take care. Bye-bye.